Welcome to the Drilling Millions podcast, presented by Sage Dental Partners.
So now let's change gears a little bit. Let's talk to you a little bit more personally about how you manage your time as a multi-practice owner. So let's maybe start about talking about how you spend your time in terms of looking at your production and costs. So how much time do you spend doing those two things?
I typically will set kind of goals for myself in terms of my own production, and then obviously the production for the practice. So, depending on, I generally, like most days, like 3 days a week, I'll work 8 to 2. So my hours have changed after COVID. I kind of reduced them a little bit, and then I made them more daytime because I wanted to be able to have a life also after work. So, 3 days a week, I'll work 8 to 2. And then 1 day a week, which is my long day, which is the Tuesday, I'll work 9 to 4. And then my Fridays, 9 to 3. Just going over my hours, I'll usually set a goal for myself in terms of what I want to be able to bill per hour. And I work not just by myself, I work with a restorative hygienist. So a concept that maybe is not everywhere, but it is in Canada and definitely Ontario, where an expanded function hygienist or a restorative hygienist, after I prepare a tooth, she can fill it, like she can restore it. And then she can also pack cord, take an impression for a crown, and complete the procedures that I've started restoratively. She can do bonding. If I'm, turning a peg lateral into, a tooth and doing a resin veneer, or, so she can pretty much do all restorative procedures. I'm giving the local, I'm removing the filling or the decay, and preparing the teeth, and then she will complete them. So we're always working as a tandem with 2 assistants and me and her, or sometimes even a floater, like a third assistant, so that we want to be very profitable and productive. If I'm going to work a 6-hour day, my goal is to be able to every day bill between $8,000 to $10,000. So I'll set a kind of a goal for myself daily, and I'll set a goal for myself monthly, depending on, the number of hours I might be working or the number of weeks I'm working. Like a lot of times I'll take, I'll typically take about anywhere from 5 to 7 days off a month.
Wow.
And then sometimes for a couple of vacations, I may take a couple of weeks off, in the summer or in the winter. And then I'll set a goal for the associates. I'll set goals for the hygienists. I'll set goals for the whole practice. And then, then I know if we're basically, and again, we'll always compare stats from what did we do in September of 2021? What did we do in September of 2020? And then obviously I want to be doing better now than I did the year before or the year before that. I'll always also, obviously I'm trying to also look and see what my wages are as a percentage of my overall production. When people are coming to me for raises, or, when I can see really what the office is doing, in terms of its entire billing or its entire collections, and where are my wages as a percentage of that. Usually I want to see my wages somewhere between 23 to 25% and these days that's a little more challenging, and it's been getting a little higher because hygienists are wanting more, staff is wanting more. It's difficult to get new staff. Post-COVID, it is definitely more challenging to be able to hire people and to get them at, a fair price. So we're always monitoring, what our percentages of the wages are out of the total billings, because I try to keep it at about a quarter. That's where the accountants come in and help, and obviously previous year's stats, and seeing, and trying to run sundries in a tight way, obviously getting things you need, getting good quality products, but at the same time, not being wasteful. being careful. I'm always trying to impress that amongst all the assistants. Hey, we're going to use what we need to use, and we're going to use quality products and materials, but you can be careful. You can be careful in how much of everything you dispense and how you use products. So, and then obviously that, like, just overseeing everything really, but I don't really let it overwhelm me. I don't really let it overtake me. I'm just, you get a good sense of it after a while. The number crunching might come, quarterly, or looking at it at a half year, or looking at it at the end of the year and reviewing things with my accountant. But that's basically on a day-to-day basis. Like in terms of management, like if I'm working, like, let's say 8 to 2, I'll usually, do about an hour of admin, let's say from 6:45 to 7:45 in the morning while I have my coffee. I'll log into the server at Bentway, or I'll log into the server at Limelight. And then lastly, I'll log into the server at my main office. And in a way, I'm kind of almost doing like a virtual huddle in the morning with my hygienist or with my assistant. Instead of having to be there going over every patient, I can quickly scan through the hygiene patients and leave the hygienist some notes in terms of what they're doing and what they should discuss with the patient according to their treatment plan that's already in place, and what their next steps are. So, like, I'll do a little virtual huddle with the hygienist regarding their patients, leaving them notes. And or if I want to leave any notes for the doctors, I will, but generally I let them just do their own thing, because they've all been trained. They all know. We actually have a nice WhatsApp group where we share cases, and I show cases to them of what I'm doing. Again, always trying to teach and always trying to improve their skill set and to expand their horizons a little bit of the things that they might want to also try to do in dentistry themselves. And that's what I do. I do that for Bentway. I'll do that for the other office. And then lastly, I'll do it for my main office. So it's about an hour of admin in the morning. And then, after work, if I'm finishing at 2:00, then I usually have about an hour to an hour and a half of admin. My goal is kind of to be out of the office between 3:30 and 4, and do a little bit of work, signing checks, talking to office managers, meeting staff, troubleshooting, doing some paperwork, reviewing predeterminations, and responding to insurance, whatever. There's always this schlepping and work that you have to do, right? Some administrative, because then I don't want to take anything home, and I want to be able to kind of block things out, go home and have a good time.
Oh, that makes a lot of sense. But on a more personal front, you and I discussed this over dinner. I always looked up to you from the perspective of, I always thought, man, Dr. Narang has it figured out from a, work-life balance perspective. You always, we follow each other on Instagram, we have each other on Facebook. And I'm like, he's always doing something. He's at Coachella one weekend. He's, he's kicking it at the weekend concert. He's, at Veld. How do you manage your time on a personal front, kind of looking at it at a macro level and kind of distinguish, between your work and your life? Because I don't think a lot of people do that very well, or as well as you do.
6 hours of dentistry is a pretty good amount of dentistry to do in a given day if you're working as a dentist, and I just kind of say, okay, I draw a line in the sand. I say, that's what I'm going to do. And I want to be able to have enough energy for my kids and my wife when I get home. So from a daily perspective, if I'm in the office from 8 to 3 or 8 to 3:30 or 4, I feel that's good enough. I've done my job, and it's now time for me to be able to either work out or go home, or enjoy some time with my family. And then again, during the summer, I have a cottage and I work 4 days a week. And I've decided I'm not going to work that the Friday and like I've got a long weekend every weekend, and I'll do that right through the whole summer. The office will run itself on the Friday and the Saturday without me. There's a lot of other providers. I'm really not needed, and I can concentrate my schedule into 4 days, work a little bit harder, and then what I'll do is I'll tack on an extra hour on those days, and work like 8 to 3. But then I've got the beauty of having that weekend off, and the Friday, and I can just go to the cottage on Thursday, after work, and enjoy my life. Or even when I'm not at the cottage and it's fall and winter and spring here, then I look at that time for travel, and I want to just enrich my life. I want to go places that I haven't been to or do things that I haven't done. And again, like, that's just important to me. I find it just gives me something to look forward to in my life. Because I've been practicing for 38 years. And if you're just working hard and there's no enjoyment or no fulfillment, or you're just, it gets boring, or you'll get tired, or you get burned out. And I see so many of my colleagues, I'm 65, and many of them are retiring or already retired. But hey, I'm really enjoying dentistry. And the reason I'm enjoying dentistry at my age is because I have good people working with me. I've learned, to rely on others, not to do everything myself, and also taking some time to stop and smell the roses and enjoy life.
Well, there are plenty of roses along your path, so and cocktails. So those key kind of people that you say that help you leverage your time, other than your restorative hygienist that you mentioned, are there any other key players in your team that you sort of tell yourself, why didn't I do this sooner?
No, again, like I said, I think each practice has to have a really good, solid administrator. And I think that's what we've been able to do, is really have a good, solid administrator at the Limelight office. And then there's people working under her, who are good people, obviously not as good as the lead person. So that obviously makes life easier, having somebody in place who really can run the show and be your advocate when you're not there. And, my lead supervisor and manager at the Limelight Clinic, which is near Square One, she's amazing. Like, she's always coming up with great ideas, and she never ceases to amaze me at the new things that she keeps implementing. And I don't have to tell her to do some of those things. She's just runs with it. So it's really invaluable to have good people like that, who kind of think like an owner. And then obviously you want to, I'll reward my people who deserve it, and pay them well and give them raises when it's needed. It's got to be a win-win. You can't be trying to do really well and increasing your numbers, but then you're going to be cheap about giving a raise where a raise is deserved. So you got to reward the people too. And you got to, and that's, I have so many staff that are loyal. They've been with me for a long time, because we try to treat our people right, treat them with respect and dignity, pay them well, have high expectations from them, but then they're your advocates. They're the ones who are talking to the patients. They're the ones that are booking the appointments. They're the ones that are making them feel comfortable in the room, when they're nervous. They're the ones that are asking for the Google reviews, when somebody's happy about the dentistry they've had, and trying to promote the practice. So that's going to happen if you've got a really good, cohesive team and people that are happy to be there, working there. So that's kind of how I strive really at each of the locations, just to have happy staff that feel fulfilled, and communicating with them, staying in touch with them, knowing that I'm looking over their shoulder, but I'm not micromanaging them, but I'm there to oversee things. And I think they respect that. And the key people, like I said, like the one lady who manages or supervises all three of the offices, my restorative, my my other person who sort of does all of the bookkeeping and banking, and my lead assistant. Those are the kind of four people that I rely on, and then obviously I have an excellent group of hygienists that are working for me. And we do a lot of ortho also in the clinic. And I have two of the hygienists that do ortho also in my main practice, and that'll be going to the new downtown location. They all help.
So where do you go about finding these great employees and great hygienists and great associates?
So I mean, again, we sometimes, we set up a nice LinkedIn profile, and we might get some leads through LinkedIn. We might get some leads through Facebook. We might get, leads through Indeed. So a lot of it's online these days. We also do reach out to agencies that we use. Sometimes we need temp hygienists or temp assistants, and we deal with certain agencies. But I'd find mostly these days we're finding people online with like a really good kind of online strategy, to find people and have people responding to us, from ads that we might put online. And obviously they're going to come in and you're going to interview them. And for me, like I always tell, whoever's doing the interviewing, whether it's Eileen or Sandra, my office manager, that call me in for a few minutes, because I just want to meet the person, just their attitude, how they respond. For me, that's huge, because I can teach people skills, but I can't teach them attitude. And I can't teach that. And if they have a good attitude, or they're positive, or they're upbeat, or they're excited, about the position, I can see that. And that's what I'm looking at. And then obviously I'll call them in for half a day. We'll call them in for half a day to have a working interview, whether it be at the admin, or whether it be, with us as an assistant or a hygienist, and I'll pay them for that half day to be there. A hygienist might do a full shift. And then just to sort of get feedback to see, how did she work out? Did the patients like her? Did the doctors or the staff like her? And that's how we kind of will reach out and hire. And, and then the thing is, hopefully it works most of the time, but when it doesn't work, man, then you just jettison or let that person go really fast. Within that, they might have them on a probationary period for 6 months. And if I'm not happy with them, or they're not doing their job, they're going to be gone within 6 months. I'm not going to let them stay as a part of the team and bring the team down or create problems or issues. It's just not worth it. So you learn to just be a lot more proactive, and then what you're trying to do is you're trying to build that ideal practice, or that ideal staff. That's how I get good hygienists, good assistants, good receptionists. I mean, it's some trial and error, but you have to just keep looking to make sure you've got a really good team of people who kind of believe in what you believe, and also are willing to do an excellent job, to look after the patient, give them great service, be on time, not hurt them, make them feel comfortable, and just again, all of those things are just important, right? Like, because, and again, consistency, like, when you have good staff and people are there, our patients are so happy. They come back and they're going to see the same assistant, or they're going to see the same receptionist, or they're going to see the same hygienist, and they feel comfortable. Sometimes they may not have a perfect relationship with one staff person, but if they have a really great relationship with 2 or 3 others, it's going to keep them in the practice.
Like what you heard? Don't forget to subscribe to our podcast wherever you listen and follow Drilling Millions on Instagram, TikTok, and YouTube for exclusive clips.